Hello, good evening, viewers in Nigeria and around the world. You're welcome to another Tuesday evening. This Talking Health with Dr. Laz on your favorite TV station, Africa Independent Television. It's 3 days to Christmas, and I know so many persons would be very excited. Yes, I am too, and as you can see, I'm in my subtle Christmas attire. Perhaps I could get some Father Christmas this thing to add to it. But let's get to what we have to do today. We are talking about HIV. In the month, we started with that. We are going to continue with that. I'm still Dr. Laz Eze, your host. And we are going to be talking about the financing of HIV. We are going to be talking about monitoring of HIV programs in Nigeria. These are very topical issues. We'll get some perspectives from the Director General of NACA, the National Agency for the Control of AIDS. And we have two specialists in the studio who are going to share their own perspectives. But remember, COVID-19 is still here with us. Recall that over 30 years ago, HIV was the biggest talk in town. It was the pandemic. COVID-19 is here and is spreading and is affecting so many persons. So play your part. Don't use Christmas to spread it, but rather let's use it to halt the transmission. So adhere to all the COVID-19 guidelines that the National Agency, NCDC, and the PTF, and all of them have already communicated to all Nigerians. We'll take a short break, and when we return, we get into the conversation proper. Do stay with us. We'll be right back. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. I have with me in the studio Dr. Aminu Magashi Garuba. He's a health financing expert. He's also a national advocate for health, the founder and coordinator of African Health Budget Network. You're welcome to the program.
Thank you very much. Thank you.
Yes, good to have you. HIV has remained a topical issue in the country, but we've made some remarkable progress.
Yes.
You know, right now, we used to have over 3 million Nigerians living with HIV.
Yes.
Right now, we have less than 2 million, about 1.8 million. So, but let me show our viewers the picture of what it is currently in the country. You're going to see that on the screen, some charts, how the 36 states are standing in the HIV. Yes. So you could see that on the screen. It might be tiny, but it ranked all the states in the country based on the prevalence of HIV. You could see from the smallest to the highest. So Akwa Ibom is like the highest at the moment. And the total number of new cases, you could see that on the right side, 103,404. You know, so that's like the total number of new infections recorded the previous year. We have over 44,000 deaths. Over 44,000 deaths. So far, COVID reported deaths is 1,206 or 212 or thereabouts. HIV killed over 44. That's more than 37 times, you know, of what COVID has killed. That's not to downplay the risk that COVID had, but is to emphasize that HIV is still here with us and we need to do something seriously. Dr. Magashi, I had a conversation with the Director General of NACA, and there was about this funding HIV in Nigeria. But before we I played that video, could you share your thoughts overall on the funding of the health sector in the country? How do you see it?
So thank you very much. This is a very important question. When you look at the overall health sector funding in Nigeria, consistently over the last 10 years, the portion of the national budget to the health sector is very minimal. We are talking about every year the federal government allocating about 3 to 4% or 5% at most to the health sector over the last 10 years. That is grossly inadequate. This is one area of the health sector. But when you go to the state level, of course, a lot of states are also contributing to the health sector budget in the annual budget. Many states now are committing 7%, 8, 10, 11, up to even 15. But that is the allocation. Now, when you look at the trend, over 12-month calendar of the budget performance, you'll find that even the state that allocated 15% or celebrating the Abuja Declaration target, they are only releasing very minimal amount of money to the health sector. So we could say largely the health sector, we are getting a lot of funding from the international donor partners. That is more or less what is driving the health sector overall in Nigeria.
But the international donor funding to the health sector is less than 5%.
Yes, but that's what people are saying.
Could you actually say that that's what's driving because the National Health Account says over 70% of healthcare financing in the country is out of pocket by Nigerians put together. Then if you pull all the government ones and all that is over 20%. So that of donor fund is actually less than 5%. So it might not be correct for us to say that that's what's driving our health sector, but it does not downplay the significance that and the value that it has to the system.
Exactly.
So so let's get into funding HIV programs proper. We can say we are winning the fight against HIV. And during the World AIDS Day, the NACA said that, in fact, if we get all the required funds by 2025, that Nigeria can actually, even before the 2030 target, Nigeria can actually, meet the 95 target. So I had the conversation with the DG, and let's hear what he has to say as regards the extent of funding by the federal government to HIV programs in Nigeria.
If funding can be enough, even globally, even our development partners will keep on telling you they need more money, but I believe what we have at the moment is helping, and we're fulfilling our pledges, and we're meeting our milestones, and and we're getting results out of it. Let me give you this scenario. Until a few years back, the government of Nigeria is not taking part in direct treatment. A few years back, we took the responsibility just to show our development partners and our friends that we are serious about ownership over time, and we are strategically positioning ourselves, to take over the entire program by the time the money meant for this program dries up. Last year, we were treating 50,000 people out of 1,200,000 that have been on treatment. This year, we're treating 100,000 out of that number. From last year to this year, we've doubled the number.
We also get to know the extent of the federal government of Nigeria's contribution towards this program. I think that's what he just said. We are treating 50,000. That's the one that the government of Nigeria was funding. But because more than that number actually, on treatment for HIV.
Yes.
So, but these numbers is like the contribution of the federal government, towards the treatment, and he believes that we can do more than that. So, what's your perspective on that?
Yeah, so I think he's right. Treating 50,000 Nigerians, we can do more. And also, as you mentioned, the federal government and the state government, they are all contributing to the funding of the health sector. They are also contributing to the HIV. But also, we need to also remember that we have a lot of support also. You are aware of the Global Fund for HIV, tuberculosis, and malaria. We are aware of a very large support from the World Bank, the IDA arm of the World Bank supporting the HIV response in Nigeria. So many bilateral institutions. It means if we put all these resources at the table, we could be able to provide and cater for more than 50,000 people in the country.
Okay, so there's a good news that NACA gave around HIV funding. Let's listen to that. I wanted to hear directly from the DG himself.
Okay. Money that is very likely going to start coming from private sector as early as next year. That money that may come from private sector, we expect should be more than what we're getting from government.
That's Nigerian private sector.
Nigerian private sector. And if you have that, just the same you have COVID for COVID-19, the HIV Trust Fund has been in the making even before COVID-19 pandemic. And with that, don't be surprised. Next year, instead of adding or treating 100,000 or 125, we may end up treating 200,000.
Okay, so the HIV Trust Fund, are you excited about it?
Well, I'm happy for anything that is good for Nigeria to improve the health sector, but also as somebody who has been, following and observing the HIV response for a very long time, since the military era, I will not be too excited, for us to have another, vertical HIV Trust Fund.
What are your concerns?
So my concern is the sustainability of, one disease trust fund in Nigeria. You are aware that in the country there are so many problems within the country. You have malaria, you have tuberculosis, agitation to have immunization trust fund, agitation to have a universal health coverage trust fund. There are so many pieces at the table.
But Dr. Magashi, you were one of those that pushed for immunization trust fund.
Exactly.
We were together in that advocacy.
That is true, yes.
So, people also argued then that it's a vertical funding.
Exactly.
So did you get converted against the vertical funding based on that experience?
So what I observed is that we are going to the same people demanding for the money.
Okay, what's the way forward?
So the way forward is we need to look at the sustainable financing for the health sector.
Okay.
We need to look at, I'll be more interested to combine HIV, tuberculosis, and malaria, and maybe the health security because of the, the COVID-19 experience, for us to have a very strong and robust public-private initiative trust fund that will drive the agenda, for a very long time, not just one, vertical HIV trust fund.
Will you support ideas? Some say we should have a health bank, just as we have an agric bank. Some said we have total health trust fund.
Okay.
Instead of just any of, because some could argue, what of schistosomiasis?
Exactly.
What of
yes.
so many other health conditions?
That is true.
So do you agree to a health bank or health trust fund?
So
based on your argument?
So I think there's a value to have a bank if it can succeed, and also there's a value to have a trust fund. So they are not the same. You are aware that recently there is a lot of agitation within the National Assembly to pass a bill on Nigeria Health Infrastructure Development Bank. That bill has already passed a second reading within the National House of Reps. So that means there's also a process to do. But that is, is a bank that will generate a lot of funding from Central Bank of Nigeria, from the donor partners, from the private sector. So that also a bank, if it exists, it could equally fund a trust fund. Because the trust fund is, slightly smaller in terms of management and structure. It's going to have an independent, board of directors that will determine, where will the money be going. They will ensure accountability and transparency. So a bank could actually finance even the trust fund.
Well, let's take that as the big picture. From what the DG said, is like the HIV Trust Fund could take off next year. And he said that they've actually hired someone that will manage the funds and finishing touches, actually COVID-19 that delayed the takeoff. So hopefully, if it succeeds, perhaps it could be expanded to cover other health conditions. Thank you, Dr. Magashi, for joining us on the program. And we are always delighted to have you.
Yeah, thank you very much too. Thank you.
Okay, thank you. We are going to take a break, and when we return, we're going to discuss briefly about monitoring HIV in Nigeria, data management, data capturing, and a good number of issues. And our next guest is already with us. Please follow us on our social media handles, and let's come back after the break. We are in the second segment, and we'll be talking about monitoring HIV programs in Nigeria. Here with me is a a monitoring and evaluation specialist. He's worked on malaria and HIV programs. Mr. Felix Ogaga, you're welcome to the program.
Thank you very much, Dr. Laz. It's my pleasure to be here on this show with you.
Thank you. So, monitoring and evaluation is part of the health management information system, which is one of the 6 building blocks of the health system. And it's simply from the first thing you do when you get to a hospital is to collect card. You know, and when you get cards, every point you go, you're either filling a form or the health workers are filling register. That is just gathering data that will help. You know, so the HIV program is often accused of using multiple, data tools to collect the data, which some health workers feel that it overburdens them because there's a general register that is used for monitoring, for capturing data for many health programs. So I asked the DG of NACA his concerns or what he feels about that, and let's listen to what he said.
It's important to look at the reason why you're collecting certain information and of what help would that information be to you or to the program. It is good to have a uniform tool and to collect uniform information, but if I use uniform tool and I collect information that is not sufficient, then that information is unlikely to help me the way I want to use information now that information technology is key in everything you do. The HIV data we are collecting at the moment is a little bit deeper and richer than any other data that is being collected for any program in the nation. Why? Because we cannot continue to monitor 90 without getting, let's say, surveillance data or data on patient treatment, as they go and as they receive this treatment and they're being managed continuously. Case-based data, that's what they call it. We cannot be efficient if we don't have that. In collecting case-based data, there are indicators that are important and that need to be added. And if you add them, your tool will look different and your tool may look complex. But it is important to have that to enable you look at the patient holistically.
Yes, you heard that. What is your perspective?
Okay, so I would like to completely agree with the director that for HIV programs, ideally, there will be need to collect far more data than the routine health management information system will be providing. Now, essentially, because most of these are donor-driven, there are lots of indicators that are required, especially for donors like PEPFAR and the Global Fund, indicators that are required that would ideally not be reported using the existing national HMIS tools. So,
but some are saying, should the donor agenda be driving our national agenda?
Yeah, so for HIV/AIDS, something a bit peculiar with our country. It's HIV/AIDS, and like some other projects, is being fully donor-driven in terms of funding, the coordination of HIV/AIDS.
That is an error. Earlier in the program we talked about funding, and the DG of NACA said federal government of Nigeria is bringing some funds. At the state level, health workers are paid by the government, by the state government. The health facility is owned by the government. Yeah. Many of the things, the equipment and all that, are procured by the government of Nigeria. I think it's the aspect of the drugs where we have the dominant donor support, not the entire HIV program in the country.
Okay, so while I agree with you with some of the perspectives you've raised, I must add by saying capacity for HIV programs, in terms of capacity building, in terms of commodities,
training, that's what
yes, they're mostly donor-driven.
Okay.
So in terms of the systems for HIV data reporting, that peculiarity could be addressed by institutionalizing systems where there are integrations across projects, integrations in that while you collect your HIV data using the various donor requirements, there should be a minimum national data sets that should be reported using the existing national HMIS system. That way, the country can effectively plan and utilize data based on key indicators that it will need for its health agenda and for planning its health resources.
Okay.
So one way to do that is why those vertical systems are there, and as the country continues to move towards looking out for effective methods or ways to integrate the tools at the level of the facility level, there should also be systems to ensure interoperability, meaning systems where data emanating from the parallel HIV systems are actually placed through the use of technology, actually placed side by side with the existing HMIS tools.
Yeah.
And from the user perspective, a user will be able to actually utilize data emanating from the parallel HIV data
So
reporting
you're
stream.
in essence, you're advocating for use of technology to get that
Yes.
without necessarily overstretching the existing workforce, because that's where a lot of the concern is coming from.
Yeah, so technology provides one of the immediate quick solutions for systems integrations in health data reporting from HIV program and the national HMIS system.
Okay, that sounds good. We are rounding up very quickly. Can you share your thoughts on, just in one or two sentences, what we need to do to improve generally the quality of health data in the country?
Okay, so essentially to improve quality of health data in the country, you must have a defined indicator reference list. By that, it means in the standardized indicators that people across various regions in the country know how to define such indicators, and the collection process is consistent across the country. There are unified tools. There are people trained with similar capacity using a standardized a standardized protocol to train these health workers across the country. And then as much as possible, coordinating systems for data reviews at state and national levels should be integrated in such that people with necessary capacities review data quality not just across one program, but across different programs. And that way we can guarantee for efficiency and improve data use in the country.
Okay, thank you very much. Thank you very much, Mr. Ogaga, for joining us on this program. We've been speaking with Felix Ogaga, a monitoring and evaluation specialist on HIV and malaria programs. So before we end the program, I want to demonstrate something. Now I ask you that we should use this Christmas to promote prevention and not spread COVID-19. So we usually see a lot of persons, including high-level public officers, using only the face shield, but we've been told by the experts as well as NCDC that face shield alone doesn't provide sufficient protection against the virus. So we must use face mask. Use of face mask alone is good to go, but if you must add something to it, then this way. So for very powerful protection, you could go for as many that can afford it. Face shield alone doesn't provide sufficient protection. So 3 days to Christmas, and that's the much we can take. We wish you and your families and everyone Merry Christmas. And thanks to all our guests, Dr. Magashi, Mr. Felix Ogaga, and the DG NACA, and to you for watching us. Please follow us on our social media handles, subscribe to our YouTube channel, and let's keep the conversation going. See you same station, same time next week. Merry Christmas.